are a busy executive mom balancing your work and family life, this can be challenging enough without the added struggle of shoulder or arm pain. Now, if you're experiencing some sharp shooting pain, tingling, or numbness down in your shoulder or arm area, so basically in this area, it could be possibly nerve related. However, it's not always the case. So, in today's video, we will discuss what are the different sources that that can cause this nerve-like or nerve-related arm and shoulder pain, and it will give you a general idea so that you can work with your healthcare professional accordingly. So, for those of you who don't know me, my name is Swati. I'm an executive mom power coach. I help moms of younger kids who work in high stress executive jobs to manage their spinal and nerve pain, and that is their back, neck, and nerve pain, despite low energy levels and brain fog or lack of focus. Now, I do this by giving you simple exercises, some easy lifestyle modifications, some tips and tricks that have helped me in my own pain and adrenal fatigue journey. Adrenal fatigue is a term that has a lot of different implications or symptoms. However, the ones that I faced mainly were low energy levels and lack of focus or brain fog or mommy brain, as it's sometimes called. And of course, I do all this without taking away a big chunk of your time because, hey, we're moms, we're busy people, right? So let's get back into the topic for today, and that is, can your shoulder and arm pain be nerve related? This is an easy guide for busy executive moms and really anybody who has nerve pain or who has heaviness and pain going into their shoulder and arm area. Now, if you look at nerve pain, typically nerve pain will be very distinct from other kinds of pain. It is often described as a sharp shooting, tingling, burning, or uh, heaviness in the area that is affected by this nerve pain. And if you have it in your cervical spine, say you have a cervical radiculopathy, so that's the first condition that can cause the shoulder and arm pain. So if there is cervical radiculopathy that is present, and that is basically if there is a nerve that is being pinched or irritated or compressed in your cervical spine or your neck area, so that can lead to this tingling, numbness, or any kind of nerve pain down in your shoulder and arm. Usually, when you're looking at the shoulder and arm area, we're looking more of mid to lower cervical spine, not so much the upper cervical spine. Because, okay, let me just back up a little bit. Your cervical spine is made up of those seven vertebrae and the nerves coming out from each from either on either side between every two vertebrae. Now, if you roughly divide your cervical spine, there's seven cervical vertebrae from your hairline down to say about this area here along the line of your shoulder here. So along the line that is the junction of your neck and shoulder here. So if you divide this area into a upper, mid, and lower part, or say a upper or lower cervical spine, so usually the middle to lower cervical spine is the area that is affected, where the nerves are being irritated, compressed, or pinched because of disc bulge, muscle spasm, could be any problem really, stenosis, arthritis, degeneration, etc. And because of whatever reason, if your nerve is getting irritated in that area, in this mid to lower cervical spine, you tend to get this arm and shoulder and arm heaviness or irritation. So that is typically cervical radiculopathy. Why does it happen? As I mentioned, some of the reasons. Apart from that, it could also be poor posture. It could be because you're slouching or hunching forward, so you poke your head out, which is a forward head posture. So if this is normal, this is a forward head posture. It could be because you're sitting for a very long time in these postures. You're not giving your cervical spine or your spine in general a break or time to adjust back to its neutral alignment. So that could be the reason. You may even feel this pain radiating down into your mid back or your scapular, the shoulder blade area. If your upper cervical spine is involved, usually people tend to get more headaches, dizziness, sometimes blurry vision, sometimes lack of balance, etc. Anyway, but we are talking more shoulder and arms, so that's more mid to lower cervical spine. Now, another thing that can happen and give rise to similar sort of symptoms is a thoracic outlet syndrome. Now, if the name is too complicated or not easy for you to remember, don't worry about it. It's basically thoracic outlet syndrome is when you have this collarbone here, so your clavicle and your first rib, which usually lies very close to the clavicle, Or if you have an accessory rib, that is, sometimes we are born with these extra ribs, so it's not like well, it could be, but it's usually like a small protrusion, kind of a bony kind of a protrusion that is looks like a rib, but it's called an accessory rib. So if you have that, or the nerve is getting pinched between your clavicle, that is your collarbone, and your first rib, that itself can lead to tingling or numbness down into your arms. But usually this one, depending on how much of the nerve is irritated, usually it'll go down into your forearm and your fingers as well. And you will find that you have a weak grip, especially if it's been going on for a while. So when you are, say, picking up your bottle of water, or something heavy, you'll feel that one side, the affected side where you have the tingling or nerve pain, is not as strong as your unaffected side. Um, what else? Let me just look at my notes here. Yeah. So if you feel when you are lifting, reaching, this weak grip, tingling in the hands, etc., it could also be nerve pain coming from your cervical spine, but it could also be thoracic outlet syndrome. So you need to be aware that there could be a possible different diagnosis than just cervical spine, cervical radiculopathy, sorry. Another thing is, locally the nerves can get compressed. So if in your shoulder or arm area, due to any reason, say you are doing a lot of repetitive movements, you have poor posture again, or you have poor ergonomics, you can, or say you are holding your phone, you're always holding your phone like this, so you're not keeping your wrist straight. However, you are doing this, so there's a lot of extension at the wrist all the time, or you're typing and you're not using a proper keyboard, or when you're holding a mouse, your wrist is always in this extension. I'm talking about typing, etc., because these are things that you do every day in your office life, and as a mom who's working in an office. So these can lead to some irritation or compression in the wrist area. Similarly, if you have a rounded shoulder, right? So if you have a hunch posture, you have a rounded shoulder, it is possible that you have some local irritation of the nerve in your shoulder and arm area. That itself can lead to heaviness or nerve pain in that area, right? So it may or may not radiate down to your forearm, into your hand, etc. Excuse me. So if these are the common ones, of course there are many other reasons why you can get heaviness or nerve pain into your arms and shoulder area. uh, if you want to read more about this, I have written a blog on this topic. In that blog, you'll also find a free guide on how do you manage your nerve pain. This guide will tell you more about what are nerve pains, how do you know if you're suffering from nerve pain, and how can you manage these nerve pains, and much more, of course. And in the blog, you also have this video which talks more about what are nerve pains. So if any of the terminologies or anything that I've spoken about in this video which is not clear to you, usually got I mean things like poor posture, ergonomics, prolonged sitting, hunching at your desk, disc issues, etc., all these terms that I used, if you're not clear, go to my YouTube channel and have a look there. Or you can just go to YouTube, type my name, Swati Prakash, say poor posture or hunch posture, and those videos will pop up for you, because I've done quite a few videos on that. So you can have a look at those. And of course, if you have any questions, any comments for me, do let me know, and I'll be happy to help you out. Alrighty, I'll see you guys next time. Bye.